pair here, I have Selena here, and her husband has been watching my videos for a while, and I guess he likes me. Yeah. So he goes, "You got to go see this guy." And so she came down yesterday, and she evaluated me and did one of these with me. Does he know what he's doing? Okay, I'll go with you. Yeah. So anyway, she started with me yesterday, and she's here because she's been having some problems with her elbow. That's why you're here, pretty much, right? So please tell us why you're here.
My elbow hurt here, and then my neck, my whole low back hurts, and then my tailbone hurts. For
I'm sorry to laugh. She came in. She's like this. She's like, "Oh, my elbow," and I go, "Okay, what else?" She goes, "Oh, this here." I go, "Oh, there's more stuff." So, the elbow, how long?
3 weeks.
3 weeks. And did you have any trauma? Any hurt? You play tennis? You grab something? It just started hurting, right?
Yeah.
And it keeps you from sleeping at night too. It hurts. You roll.
Yeah. They even play iPhone, iPad.
That's right. I forgot about that. So she plays the iPad. She goes, "When I am on the iPad, it hurts my arm."
Yeah.
She goes like this. That's right. And then your tailbone pain. How long has that been going on?
More than 2 years.
More than 2 years. And any trauma from that? Any falls? Any auto accidents? No injuries, right? And then you also have low back pain. And 2
years more.
2 years. Your knee, a little bit of your knee pain. What's that?
Yeah, here.
Oh yeah, hip. That's right, hip pain. Headaches. How often do you get headaches?
I have almost once a month.
Once a month, right? And how long has it been going on? For years, or off and on for years, or 2 years, 3 years, 5 years, 2 months? What?
Years. Many years.
Many years. Gotcha. So she has never been to a chiropractor before. First one, right? She just reportedly told me she's a little nervous too to be here, which is fine. What have you done in the past for all this pain? You've been acupuncture?
Acupuncture, massage, and physical therapy.
Gotcha. And so when was the physical therapy, by the way?
I think 2 years ago.
2 years ago, okay. And so if physical therapy was so good, she wouldn't be here, guys. Just telling you guys. Acupuncture, she just went fairly recently, went for a couple of visits, and it didn't really help a lot. So she's here. She's at her wit's end. She wants to get better. Now, a couple things here. Look at her skin. Come here. And we were talking about this before. See all these marks over here? This one in particular has been there over a year. Okay? And she has it on both hands. And the biggest interesting thing is this is where her pain is right here. And you can see this right here. And the reason this is here is because she's itching her arms. Constantly itching. And the itching is, you can step back a little bit, the itching is because her nervous system is so sensitive that it's making her skin kind of crawl a little bit. And she itches it so much, she creates this. And she thought this is an old bug bite. And it may have been, but it hasn't healed because she keeps itching it. So that'll be interesting to get a follow-up video on that, if we get rid of that. It's been going on for quite a while, all this skin, right?
Yeah.
Let's get you checked. Anything else? Was there anything else? I forget. That was it, right?
Yeah,
Should I go here? So we're going to go through a range of motion and see how she's doing. Knees straight, bend over, touch your toes best you can. Any pain in your back?
Yeah, it's very tight.
Where? Here?
Here,
And on a scale of 1 to 10, what is that?
6.
A 6, okay? Go back like this.
Oh.
What is that?
8, here.
An 8, okay? Now with your neck, put your arms down, please. Go down like this. Any pain in your neck?
Not that much.
Not that much? A 1 maybe?
Yeah.
Okay, look at 7.
Hurt.
How much is that? 5, 6, 7?
5.
Okay. Now, strength-wise, let's shake her hand. So squeeze as hard as you can. Now, you can see this. See how she's bending her wrist to hold my hand? This is how it's supposed to be. But she can't do it because she can't even squeeze her thumb right now. It's weaker, right?
Yeah, here's.
It's weaker, right?
Weak.
Now it's this one? Which hand? Are you right-handed or left-handed?
Right.
Okay, look at this. Now, see how her arm is straight right here? That shows me her weakness. This is much stronger than this side, right? And look at this.
Her.
Yeah, so we're going to show the difference on that too. Let's get you treated. Okay, over here, please. So this is your first time, so just relax the best you can, okay? We're going to go nice and slow, just like other videos. We'll take our time, okay? Good. I'm going to just right in here.
Oh.
Whoa. Was that painful? Was it scary? Was it what? What was that reaction?
Both.
Both?
But feel good.
That's the best reaction ever. I'm sorry to scare you like that. We got one more, we're done, okay?
Mm-hmm.
Okay, good. Okay. This side should be a little bit easier, okay?
Mm-hmm.
Good, nice and relaxed here. Okay, you just gotta relax, Selena. Let go here. Okay. She's a little scared this time. She's not relaxing like she did on the other side.
Oh. Oh, hurt.
You okay? You're gonna love this adjustment. Okay, so that's it. Okay, you did it. You made it. Okay. Okay, so in a minute you're gonna get up, just like in the videos. No twisting or turning. Okay. You're gonna look straight ahead. Keep your arms at your side. Okay. You okay right now?
Yeah.
Good. Good. Stay right there. Bring you up here. Look straight ahead. Put your legs over the side. Look straight ahead. Sit on the table, please. Okay. Are you lightheaded at all?
Yeah, little bit. Yeah.
That's me rebooting that system I told you about.
Yeah.
The computer, right? And so when I do it, your body's in kind of a state of kind of scared. So it just needs to calm down. So the walking is going to help recalibrate your spine. Okay, just walk and relax.
Yeah.
Look straight ahead, arms down. Go ahead and walk, please.
You do have some widgets, but they are for medical necessity. So we can try, but
Okay, guys, we do so many videos now. We actually have a. Go ahead and stop walking back that way.
Can I touch your knee?
right.
It's funny, it's on the video. Did I touch your knee?
Well,
Did I rub your back?
I mean, they
Stop right here.
end
Lightheaded
up
still at all?
telling us that they would
Yeah, getting better.
Good, one more lap, please.
summary.
The walking helps really work it out. Relax your
When-
shoulders.
If that happened, they would let you know, but we could use your visits anyway. And you just have a very foot.
You can see by your eyes, he's a little still lightheaded, a
You wanna
little dilated
put
still.
one
Just up right here. Okay, before we go anything else, do you feel any different? Right off the top of your head. We're going to go through everything again, but I just want to know just the
Just
first initial.
relax.
Relaxed.
Relax,
Good, okay. So let's go through those range of motions we did in the room, okay? Knees straight, bend over, touch toes best you can.
What do you work with?
Oh, getting better.
Go ahead and stand up. You were a 6 out of 10 before. What is it now?
I think right now it's 2, 3.
2 or 3. So 60% better than it was. Go ahead and go
The
back.
second Saturday of every month, but it varies.
Still hurt, but
Um,
getting better.
It was an 8 out of 10 a minute ago. What is it now?
4.
4. So
Oh.
3 or 4. So 60% better. Did I touch your back?
Bye.
Did I rub your back?
No,
Did I even look at your back?
no,
Yeah. What did I touch?
neck.
Only your neck. Okay. Now look at put your hands down. Now go ahead and look at the floor, please. How's your neck there? No pain there
No
before it was a
pain.
1. Look at the ceiling. There was no pain there before, right?
No,
Okay.
better.
Okay, yeah. Now let's shake hands.
Yeah, can get some three.
You tell me.
Yeah,
Does
can
it
get
feel
some
different?
3. Yeah, get a lot of.
So does it feel
little
stronger?
bit Power.
A little stronger, right?
Yeah,
Okay.
yeah.
Okay, now look at this again, guys. Now, she couldn't keep her arm straight before.
Yeah.
Look at it straight now.
It's nice.
And it feels better, right?
Yeah.
Good.
Yeah.
Oh,
Okay,
hi.
what else did we check? Anything else we checked? I think that was it, right? Yeah. Good.
We are not open
I
on
will
Different, right?
try. Yeah. Well,
like
getting
it?
better, huh?
You like it, right?
Warmer.
Okay, so
we're not.
do you feel itchy at all? I'm just curious. Any changes?
Right now, no.
Okay, well, we'll see.
Sometimes,
We'll see. We'll check that out
Do you
later.
wanna
Thank you very much for the video.
Friday?
Thank you,
Okay,
thank you.
see you guys.